We become nutritionally deficient due to minerals that are lacking within our diet. Our industrialized state that we're in, an overload of toxins in the environment, in our food, in our air, in our water, the lack of nutrition in our denatured foods, lack of minerals in our denatured foods.
Minerals are what has been called the catalysts to life. Without minerals, we don't live. Senate document number 264 stated very clearly that minerals give us our immunity from disease and also help us to repair from disease should we fall ill. They also stated in that document that the American people have been deficient in minerals for many years because we have farmed the minerals out of our soil. So the foods that we're growing no longer contain the full range of all the minerals that we require to maintain our health.
The tomato that you buy commercially has 75% less nutrition in it than a tomato you might grow in your own backyard. Most of the foods that we purchase today are denatured in that they are overly processed and the essential fats are removed and artificial fats are placed in. These artificial saturated fats, hydrogenated oils, block certain pathways, adding to the allergic response of the patient.
One of the areas of great interest is the phenomenon called the leaky gut syndrome. The leaky gut is just like it sounds, is that for a variety of reasons, poor diet, exposure to alcohol, exposure to antibiotics, infections in the digestive tract, you go down a long list. The lining of the digestive tract stops functioning as a barrier and starts allowing in partially digested food, toxins from bacteria and other microbes in the digestive tracts, chemicals that normally would never allow to be in. And so it overloads the immune system.
When people are either potentially or have some inherent capacity for allergies and they develop an infection of any kind, and this is common in people with asthma or hay fever, when they get low-grade infections in the respiratory tract, their allergy symptoms are enhanced. Also, I find, and it's pretty well studied, that certain worms, intestinal parasites, and amoebas can stimulate an allergic reaction in the body and all of a sudden cause allergies, both classical kinds of allergy symptoms like sinus allergies and other more subtle ones like mood swings and energy level changes when we develop these allergies. I've seen in my practice often that when we get rid of these allergies and get the digestive tract working more properly and also change people's diet to help them clear some of the allergens, that they no longer have the symptoms that they were manifesting.
From our experience, we found that 85% of most people's allergies come from wheat and from milk. So just from a simple understanding, if 85% of most allergies come from that substances, that it would be a good idea to maybe eliminate those substances or cut way back on those.
I would say the food, probably my favorite foods are the ones that would give me the problems because those are the foods that I was constantly eating. Basically coffee, milk, wheat, eggs, just all the regular staples of my diet.
In a natural way of thinking about allergies is those foods that we crave the most or that we have to have or that we couldn't live without, or those substances that we're most attracted to are likely the culprits that could be causing problems. These could be milk products, they could be sugar, they could be refined flour products, they could be crackers, they could be caffeine. So the first level of working on your own allergies is to look at the 3 things that you like the most and eat and use most often and take a month and get those out of your diet and see how you feel.
If you're going to be eating animal protein, it should be extremely lean. Fat is a great storage site for antibiotics and hormones and dioxin and PZBs and all kinds of chemical pollutants. And you get that if you're eating a lot of animal products with a lot of animal fats. You cannot drink alcohol and be food allergy free, even for those of you who are trying to get your antioxidants from red wine. It makes you prone to developing allergy. It creates a leaky gut. You cannot treat chronic pain with aspirin and aspirin substitutes like ibuprofen and Clinaril and Feldene and more powerful anti-inflammatories. Why? Because it causes a leaky gut. You can't treat every infection that comes down the pike with antibiotics. Antibiotics indirectly, by causing overgrowth in the digestive tract, create a leaky gut, and so forth and so on.
You should concentrate first on eliminating the toxins in the diet, then concentrate on your choices of foods. And when you've gone that far, the next step is to eliminate also the nightshades. The nightshades have a certain chemical in them that can accumulate in the body and affect some arthritic patients. So the nightshades are tomato, potato, peppers, cayenne, tobacco. It's very important for people to know that. Tobacco is one of those allergic, addictive substances as well. And it does have a chemical that accumulates in the body.
So far as chemicals are concerned, people are frequently allergic to natural gas, gasoline and propane, chlorine. Many of our patients have difficulty taking baths or showers because of the chlorine content of the water, and they have to have a water filter to help them. Perfumes, any kind of scent and scented products, whether it's perfume or scented detergents, scented bath soap, or even clothes washing soap, tend to be the common chemical allergens. People tend to be allergic to grass pollen, weed pollen, tree pollen, as well as mold and animal danders, whether it's cat hair, dog hair, feathers from birds, and of course mold. There's probably 3,000 species of mold in the world. Some are pathogenic and some are not, but people tend to be allergic to these. And this is an allergy which is present year-round.
Dust and molds and pollen can cause much more than hay fever, asthma, and eczema. Some children become suicidal every year at the same time when a certain pollen is in the air. They'll become suicidal on rainy days because of mold. We weren't taught about this when I studied allergy and immunology, and I can tell you this exists. Why it isn't accepted, I really don't know.
Cerebral allergies are relatively common. I see in my practice often people who come in and have problems concentrating, and I think a lot of this comes from the digestive tract and an imbalance in gastrointestinal function. Currently, the ability to evaluate the function of the environment and the way the body handles and digests and assimilates foods has really been a great benefit in my practice and the practices of many doctors around the country. Evaluating whether there's growth of yeast or parasites and whether there's adequate levels of hydrochloric acid and digestive enzymes to help digest the foods completely. When we don't digest properly, or we have these organisms that tend to ferment and create other toxins in the body and get absorbed into the bloodstream, then these can affect the way the brain functions.
When we think of allergens, we generally think of common allergies like a milk allergy. But what about allergens that cause us to be overweight, or cause PMS to exacerbate, or cause sleep disorders, or even cause alcoholism?
What isn't spoken about that is very important are the brain allergies. Those, very good example of a brain allergy is the alcoholic. Those kind of allergies elicit mood swings, and a person will crave the allergy. They feel better when they have the food. Sugar is one of those things that happen to be a brain allergy. Sugar follows the same biochemical pathway as ethyl alcohol. So there are those of you out there that are addicted to your cookie and your cake and your refined sugars in the diet. You feel better when you have it. When you try to do without it, you feel worse. And you sometimes go through withdrawal symptoms. It's very difficult to try to get patients off sugar, refined sugars, because of that reason. They become addicted to the particular substance.
The question between alcohol and allergy is now looks like it is more and more related. About 76% of people with alcoholism appear to have a genetic component that makes them more susceptible. About 20% of the people are born allergic, which is a sort of a genetic type transformation, that susceptibility.
As a solo practitioner in private practice, I see many patients for a variety of conditions, including alcohol excess.